back. Now we're going to explore the appendicular skeleton. The pectoral girdle is an incomplete ring that supports the upper limbs. It consists of the two scapula, or shoulder blades, and two clavicles, commonly called the collarbone. The clavicles are somewhat of an S-shaped bone, and they're located at the base of your neck. The clavicles act to brace the scapula. Here you can see that the clavicle attaches on one end to the manubrium of the sternum. On the other end, it articulates with the acromion process of the scapula. We'll go over that in a few minutes. It has a slight S shape, kind of a mild S. So the clavicle has two ends. The sternal end is where it articulates with the sternum, and this is somewhat straighter than the acromial end, which articulates with the scapula. This makes sense. You don't want to have that little hook or bend right in the front of your chest. So you can actually put your hands on your manubrium, and you could feel the two ends of the clavicle, and they're somewhat straight. Now we'll look at the scapula. The scapula is a triangular shaped bone. It's located on the posterior aspect of the thorax and has a variety of different features. The acromion process is the part that articulates with the clavicle. And notice that we said on the clavicle there's an acromial end. So often with bones, we'll see that the names somewhat align. The coracoid process looks like a little beak. It's on the anterior aspect of the scapula, and this is an attachment site for limb and chest muscles. The glenoid cavity is the area that articulates with the head of the humerus, forming the shoulder joint. Let's look at some other parts of the scapula. Remember that it looks like a triangle. It's kind of flattened across the top and comes to a point at the bottom. The lateral border is also referred to as the axillary border. This aligns up with your armpits. The anterior aspect of the scapula is very smooth and depresses slightly inward. This is called the subscapular fossa. The medial border aligns up with your vertebrae, so it's also referred to as the vertebral border. The spine of the scapula divides the posterior aspect in two regions, the upper region and a lower region. The upper region is called the supraspinous fossa, so it means, just think supra as in like superior means above, spinous pertaining to the spine, fossa means depression. Below the spine of the scapula, you'll find the infraspinous fossa, and infra referring to inferior. Don't worry about any of the additional parts that are indicated on this slide. The images that I'm showing are from your APR program, and they're the same images that will be on your lab practical exam. Make sure you make note of what's a posterior view and what's an anterior view. If you put your hand on the back of your shoulder, you'll be touching the posterior aspect of your scapula. Remember, coracoid means beak-like. Looks like a little bird beak. Now we'll look at the bones of the upper limb. Now let's look at the humerus. The humerus is a long bone that extends from the scapula to the elbow. Some key features include the head. This articulates with the glenoid cavity of the scapula, forming the shoulder joint. Beneath the head, and the head does look like a little bald head, you'll see a line that represents the anatomical neck. Beneath that is the area where the humerus is most often broken. This is referred to as a surgical neck. Lateral to the head, you find the greater tubercle. Tubercle just means projection. Anteriorly, you'll find the lesser tubercle. And the distal part of the bone is a little round ball called the capitulum, and this articulates with the radius. Other features include trochlea, which means spool, and this is the area that articulates with the ulna. On the lateral aspect of the humerus, there's a roughened patch called the deltoid tuberosity, where your deltoid muscle attaches. Looking at the distal aspect of the humerus, anteriorly there's a depression known as the coronoid fossa, and posteriorly there's a depression referred to as the olecranon fossa. Okay, let's look at some of these parts, right? So you can see the head, it's kind of colored in white. Right beneath the head is the anatomical neck. See the surgical neck. Located laterally, you have the greater tubercle. Anteriorly, you have the lesser tubercle. And the easy way to distinguish between the trochlea and the capitulum is if you put your arms, correct anatomical positioning, your radius is lateral, the head of the bone is always medial. So if your radius is lateral, at the distal part of the bone, we have those kind of three bumps together. The most lateral bump is going to be capitulum. That articulates with the radius. And the ulna is medial. So the trochlea is going to line right underneath the head of the bone. Now, a lot of students try to figure out which is left, which is right, and that can sometimes be a little bit confusing. I always go in identifying different structures, what aspects medial versus what aspects lateral. You'll find that a lot easier if you kind of look at it that way. Right, showing the humerus. Right, so we can see it anteriorly on the left and posteriorly on the right. And you can see the ulna on the right hand view. We're going to go over that in a few minutes. That forms your elbow joint, the hinge joint, which is your elbow joint. Right, so head, you see it inside the glenoid cavity. Anatomical neck, right beneath the head. Surgical neck. Right, greater tubercles, right lateral to the head, lesser tubercle being anterior. The deltoid tuberosity is just a little roughened patch on the lateral aspect of the bone. So remember, the ulna is going to articulate with the trochlea. The capitulum is going to articulate with the radius. The depression on the anterior aspect of the bone is the coronoid fossa. When you bend your elbow all the way in, if you're flexing your arm, since the ulna is a hinge joint, that projection that you can see on the top of the humerus is going to go into the coronoid fossa. So here you can see the head of the radius articulating with the capitulum and the ulna articulating with the trochlea. Articulate just means where they join together. All right, the key way to indicate the radius is the head of the radius. It's round. To me, it looks like a radial tire. This is a lateral bone of the forearm. It's on your thumb side. And its features include the head. This also forms part of your elbow joint, but this is a pivot joint. If you were to like hitchhike, rotate your hands, right? You are rotating your radius around your ulna. Your ulna remains stationary, right? So the head forms a pivot joint with the capitulum of the humerus. Other features include the radial tuberosity. This is the attachment site for your biceps brachii muscle, and little points at the bottom. Sometimes you call it like somebody's got a skinny wrist, but those points right before your wrist are actually caused by the presence of the styloid process. Remember, we also had a styloid process as part of the temporal bone in the skull. So styloid just refers to stylus. It's a projection that's very thin and pointed. This slide shows the entire radius. So you guys have it a little easier than the classes on site. The classes on site, all the bones are identified, disarticulated. However, in the APR program, they always show the radius together with the ulna. And if you notice, there's like a membrane that connects them. That's an interosseous joint. It's a slightly movable joint that kind of keeps the two bones parallel to each other. Here's the head of the radius, radial tuberosity. Again, another point down at the bottom. So both the radius and ulna have styloid processes. The ulna is the bone that is located on the pinky side of your arm in anatomical position. So this is the medial bone of the forearm. And the features include the trochlear notch, which is going to articulate with the trochlea of the humerus, forming a hinge joint. Other features include the olecranon process. When your elbow is bent, the olecranon process is exposed, and if you whack your elbow, or they say whack your funny bone, what you're hitting is the olecranon process. And there's a really narrow passageway there for the ulnar nerve. So if you kind of sting your ulnar nerve, that's when you hit your funny bone. There's a coronoid process. That's going to fit into the coronoid fossa when you flex and bend your arm. And there's also styloid process on the distal aspect. This gives you a good view of the trochlear notch. It's going to articulate with the trochlea. Notice that all of these images from the textbook show the articular cartilage, or the white material that's on the end of the bones. Right, do you bend your arm? Your olecranon process is exposed. Don't try this at home. Trochlear notch. To me, this looks like a lower lip. Coronoid process of the ulna. Right, this shows you the styloid process of the ulna. This I mentioned before, the interosseous membrane, which is the radio-ulnar joint, the joint between the radius and the ulna. Let's look at your hand. Your hand consists of your wrist, your palm, and your fingers. Your wrist consists of 8 carpal bones, and we're not going to study the names of the 8 bones. You just need to know you have 8 carpal bones. Your hand, obviously you have 5 hand bones because you have 5 fingers. Fingers are called phalanges. Your hand is referred to as your metacarpal, meta meaning beyond. So carpal, beyond the carpal is metacarpal. And fingers and toes are called phalanges. You have 3 phalanges on each finger except for your thumb that lacks the middle phalanx. The phalanges, don't worry about this for a test. The phalanges are given names: proximal, middle, and distal. Now we're going to look at the pelvic girdle. It consists of 2 hip or coxal bones, the sacrum and the coccyx. The function of the pelvic girdle is it supports the weight of the trunk, the body, transports that to lower limbs, provides an attachment site for lower limbs, and helps protect pelvic organs. So this is showing one of the pelvic bones, right? So there are 2 pelvic bones, a left and a right. The acetabulum is a large depression that articulates with the head of the femur. This forms your hip joint. The large opening at the bottom is referred to as the obturator foramen. The coxal bones actually consist of 3 bones that are fused together. And if you look very closely, sometimes you can see the line. If you put your hands on your hips, that's your ilium. And then posteriorly, you have the ischium. And then anteriorly, the pubis. And the 3 bones are all fused together at the acetabulum. Again, sometimes this is not readily apparent. The ilium is the largest and uppermost portion of the hip bone. The features include, if you put your hands on your hips, that's your iliac crest. And posteriorly, there's a roughened patch that forms the sacroiliac joint. That's where the ilium articulates with the sacrum. You have your hands on your hips. You move your hands forward. You should be able to feel a slight projection that's called the anterior superior iliac spine, which is always abbreviated, makes it a lot easier, as ASIS, or the as is. If someone is very thin, sometimes this projection is apparent, and then people say, "Oh, you have such skinny hip bones." So that would be the as is. Right? You can see that. Now this is a little hard to distinguish between the ischium and the pubis. The ilium is up top, the ischium is in the back, the pubis is in the front. Right? Put your hands on your hips, the iliac crest. Move forward, you find a little spine, the as is. And then this slide's also showing the obturator foramen. And if you look here, you can see how both of the iliums articulate with the sacrum posteriorly. Another part of the ilium is the greater sciatic notch. This is where the sciatic nerve passes and where the ilium articulates with the sacrum. It's the sacroiliac joint. This one's weird. You could either say iliosacral joint or sacroiliac joint. It's one of the only medical terms that's correct both ways. The ischium. This is the posterior part of your coxal bone. This supports your weight during sitting. So when you sit down, you lift your legs up. It forms kind of a little platform for support. And what you are sitting on is your ischial tuberosities. So ischial tuberosities are the part of the ischium that you sit on. And there are projections on the ischium that are called the ischial spines. The pubis is the anterior part of the coxal bones, and its feature includes the pubic symphysis. This is where the two pubic bones are joined together, and the obturator foramen. This is kind of a nice color-coded picture. If you look on the right, you can see where the three bones fuse together inside the acetabulum. You can see the iliac crest, the anterior superior iliac spine, greater sciatic notch, ischial spine, ischial tuberosity, right? Obturator foramen. This is the part you sit on. Just very briefly, just go over the differences between a male and female pelvis. Right? A female pelvic cavity is wider in all diameters. It's broader and less funnel shaped. There is a greater distance between the ischial spines, and the ischial tuberosity is greater. A female sacrum is wider and it's curved slightly posteriorly. If you look at the pubic bone, the pubic arch, and this is kind of easy because you can use your fingers to measure. Again, you're not going to have to worry about this for an exam, but the pubic arch of a female is greater than 90 degrees, and of a male is lesser than 90 degrees. All these differences occur to enable childbirth. Right? This increases the pubic outlet, and so the infant is able to pass through the birth canal. This is also why women have wider hips. You also have larger ischial tuberosities, so we have larger buttocks area. It's something anatomically you cannot fight. So on Site Lab, we have the infant skulls, right? So I give the groups either female or male pelvis. And you can see how the infant skull passes very readily through the female pelvis, but kind of gets stuck through the male pelvis. That baby's going to hit its head on that sacrum, I can just tell from here. Now let's look at the femur or thigh bone. This is the longest bone in the body. Its key features include the head, which articulates with the acetabulum. It also articulates distally with the tibia, with two projections at the distal aspect of the bone, the medial and lateral condyles. Other features include the neck, right? Similar to we saw the neck on the humerus, and greater and lesser trochanters. Trochanters are like supersized tubercles. They're very large projections. The patella or kneecap is a sesamoid bone located in the quadriceps femoris tendon, which passes anteriorly over the knee. Right? This is showing the femur. You have the head, neck. The greater trochanter is lateral to the head, and the lesser trochanter is actually on the posterior aspect of the bone. An easy way to tell where the medial condyle is it be located right below the head, while the lateral condyle be on the other side. Head of femur, neck. Right, so you can see the lesser tuberosities are located posteriorly. On each of these slides, it's a little confusing. They have an anterior and posterior view. So you see the little knobbies that are sticking out, like on the picture on the left, the image on the right, that would be a posterior aspect. The linea aspera is a projection on the shaft of the femur, which is an attachment site for gluteal muscles. Right, shaft of the femur. Right, you know we tell medial is because it aligns it with the head. Right, laterals to the side. The fibula is the slender bone that lies lateral to the tibia. This does not bear any body weight. I always call this like the nondescript bone. Its key features include the head, and then distally the lateral malleolus. And I always call this the ankle ball. It's kind of the ankle ball, the little round ball that's on your outer ankle. The tibia is also known as your shin bone, and this is the bone that supports the weight of your body. It articulates with the femur. It also has the medial and lateral condyles, which align with the medial lateral condyles of the femur. It articulates with the talus of the ankle to form your ankle joint. Other features include the anteriorly located tibial tuberosity. This is the point of attachment for the patella ligament, and the medial malleolus. That's the kind of little round ball that's found on your inner ankle. There's the patella in place. Right, so sesamoid bone is a bone that's located in the tendon. In this case, it's a quadriceps femoris tendon. This view shows you if you look distally, the lateral and medial malleolus. So the fibula kind of acts as a brace, doesn't support any of the weight of your body. You can also see that there's an interosseous membrane found between the tibia. This slide shows the interosseous membrane forming the tibiofibular joint. Wherever two bones articulate together, there's a joint. And a joint does not have to be freely movable. This joint is very slightly movable. For instance, think of your teeth and their teeth socket. Your teeth are held in by periodontal ligaments. That's an immovable joint. So not all joints have a wide range of motion. Let's look at the foot. The foot consists of the ankle, the instep, and the toes. The ankle or tarsus consists of 7 tarsal bones. We're going to look at two names in particular. You have the talus that articulates with the tibia and fibula, and then your heel is known as a calcaneus. This helps support the weight of your body. Your instep or metatarsus or metatarsal bones consists of 5. It provides the arch to your foot. And then just like fingers, toes are known as phalanges. There's three phalanges on each toe except for the great toe. The great toe lacks the middle phalanx. Ooh, there's a lot of toes there. This shows a heel, calcaneus, tarsal bones. You don't have to worry about the individual names of them. Toes. The end. I hope you really enjoyed Chapter 7 on the skeletal system. You will be identifying these bones and bone parts for your lab practical exam.